Hello there. So you must be my next appointment. Wonderful. And you've already spoken to the nurse and she's shown you where to sit down. Great. My name is Dr. V, and I will be the one taking care of you today. So we'll just go ahead and get started by asking a couple of questions if you're okay with that. Please know that if anything is too uncomfortable or you'd rather not share, you are more than welcome to just say that you decline, okay? Wonderful. For the most part, we'll just be updating our charts. So, if it's okay with you, go ahead and just sit back and relax and answer my questions for this minute, okay? Okay. So, if you could just tell me your first name. Wonderful. And your last name. Perfect. And if I could just get your date of birth, please. Incredible. And could I get your current address? Are you currently taking any sort of medication? Yes, absolutely. Okay. So this is just for physical illnesses, chronic illnesses, birth control, any sort of kind of medication of that sort. Okay. And are you taking any medication for any mental health reasons? Okay. Perfect. So, are you allergic to anything? Medication, dogs, cats, weeds, anything of that sort? Gotcha. Wonderful. And when did you last go to a doctor's appointment? Okay. And now I'd just like to know, how are you feeling today? Any sort of anxieties or sadness or feelings of frustration, anything like that? All of that is normal, by the way. Okay. Thank you for sharing. And have you been sleeping well? What kind of sleep have you been getting? Okay. And is that normal for you? Okay. What time do you normally try to go to sleep? And do you have any sleep time rituals? Like, do you always stretch before bed, read a book before bed, watch TV before bed? Do you have something that you do every night? Okay. Gotcha. And do you have any concerns that you would like to bring up during our appointment today that we can check out for you? Okay, yeah, we can look at that. No worries. I'll just mark that down. And have you had any recent injuries in the past 6 months? Injuries that would have led you to an urgent care or an ER? And lastly, do you have any pre-existing conditions that you'd like us to know about before we get started? Okay, thank you. Okay, so now we're going to start the exam. I am just going to put on some gloves because I will be touching and getting quite close to your face and your body. Are there any parts of your body that you would like me to stay away from? Sure. Okay. I will be touching your face, but I do just want to make sure that I have consent to get quite close to you. Is that okay? Wonderful. I will be wearing gloves, so I'm just going to put those on. Is the weather nice out today? That's good. Any plans after this? I know these appointments aren't always the most looked forward to. Gotcha. Well, I'm glad you're here. And I might have mentioned before, this is a safe space. Nothing leaves this room. So if there's anything you need to talk about, just let me know. Okay. I'm happy to listen. Okay. So, like we said, I am just going to go ahead and touch your face. I will be examining a couple different parts of your body. So first, what we're going to do is just make sure all of your muscles are moving the way that they're supposed to. So we're going to go from the bottom up. So go ahead and just wiggle your toes for me, okay? Just go ahead and wiggle your toes. Perfect. Very good. I'm just going to grab my little tool here. And I'm just going to tap at your knee to see if we get your little knee reflex, okay? And good. And very good. All right, and would you mind just moving your arm back and forth like this for me? And the other one back and forth like this for me. Very good. And can you lift your hands all the way up over your head? All the way up over your head. Very good. Very good. Now I just need you to move your shoulders up and down. And relax them when they come down, up and down. Alright, and now I just need you to move your head back and forth from side to side, side to side. Alright, and give me just a little nod up. Down. Perfect. Now please raise your eyebrows all the way up. Perfect. And can you bring them as far down as you can? Very good. So there are a couple of things I noticed. So if you could go ahead and just raise your eyebrows again. I'm just going to touch your muscle as you do it. Raise your eyebrow. Very good. And raise them again. Very good. And I'm just gonna put my hands at the sides of your cheeks. Go ahead and smile big for me. Smile, smile. Very good. And now I'm just gonna put my hand at the base of your chin, and I just want you to open your mouth. Very good. And close it. And go ahead and just clench your jaw. Clench your jaw. Keep clenching. And release. Very good. Very good. Your muscles all seem to be working the way that they're supposed to. Now I'm just going to take a little preliminary exam of just your skin and your complexion and the skin that you do currently have showing right now. So go ahead and just relax your shoulders. So I'm just going to take out my little light here. It is a bit bright, but I'm just going to examine your skin, okay? We're just checking for any abnormalities that we might want to send off to any lab, and just make sure that any moles or freckles are healthy and a-okay, alright? Okay. So if the light gets too bright for you while I'm at your face, go ahead and just look at my nose or look behind me. You don't have to look into the light right now. Alrighty, let's see. There's just one up here I wanted to check out. Okay, that's fine. And there's one just right here. Check that one out. I'll just Alright, so now I will just examine your arms a little bit and your hands, so go ahead and give me this hand. I'll turn off my light for this as well. I'll just take your hand. Just checking your fingers. And your skin looks fine here. Let me go ahead and take this little hand now. Just check up your arm. And your fingers. And your skin looks fine here too. Very good. Can you just attempt to push your shoulders up? I'm going to try and hold them down. Just go ahead and attempt to push them up for me. Very good. Very good. And now I'm going to do the same thing with your face. I'm just going to put my hand on one side of your face. And I'm just going to go ahead and have you try and push your head against my hand and see if you can move my hand, okay? Very good. And the other side. Go ahead. Okay. Wonderful. So, I am just going to take a quick look into your ears. Make sure everything looks a-okay in there. So, go ahead and just turn your head a little bit to this side for me. I'm just going to check this ear. I'm going to use a Q-tip. As you should know, these don't go directly into your ear. This is just to check the outer corners and the outer frills of your ear to just make sure that everything's clean and just keeping it, nice and soft, as your ear is very tender skin. So if you do feel any sort of discomfort while I'm doing this check, just let me know, okay? Perfect. Okay, so I'm just going to put my light on. If you feel any discomfort. Very good. Very good. Wonderful. All right. On the other ear. Again, just let me know if you feel any sort of discomfort. I'm just going to shine my light right into your ear here. Very good. Wonderful. Your ears look clean. I don't see any sort of inflammation or anything. I am just going to make a couple of sounds to make sure that you are receiving information the way that you should be, okay? So I'm going to hold a couple of items away from your vision, and I just want to know if you can tell me what that item is made out of. If you can tell me what it's made out of, okay? So I'll start with this one. And I'll tap on it with something else just so you can get a better idea. Alright. Do you have an idea of what this item is made out of? It's glass. It's made out of glass. Very good. It's an old perfume bottle. Alright, the next one. Let me know, what do you think this item is made out of? What do you think it's made out of? You'd be right, that is paper. It's made out of paper. And lastly, let me know what you think this item is made out of. What do you think it's made out of? Metal or tin. Incredible. Perfect. So now I do need you to go ahead and close your eyes for me. Keep them closed. Thank you. So now I'm going to make sounds in one of your ears, and I just want you to raise the finger on the side of your head that you think the sound is coming from, so left or right, okay? Wonderful. All I gotta do is raise a finger. Alright, keep those eyes closed. Perfect. Alright. Which side? Perfect. That was your left. Alright. And now. Correct. That was your right. Alright, a couple more. And again. Wonderful. Alright, now I'm just going to whisper a couple of words into each of your ears to make sure that you're receiving sound exactly the way that you should, okay? So, pickle, pickle, pickle. What word did I whisper in your ear? Alright, and the other one. Cupcake, cupcake, cupcake. What word was that? Perfect. Alright, a couple more. Little rock, little rock, little rock. What word was that? Or words, I should say. And camping, camping, camping. Very good, very good. You can open your eyes now. Go ahead and open your eyes. So now we're going to take a quick break from these exams. I do want to get your vitals. I know that the nurse already took your vitals a little earlier, but we just need them for our records on this side. So I'm just going to take a listen to your lungs real fast. So I'm just going to go ahead and place my little monitor on your chest real fast. Is that okay? Okay. And go ahead and inhale. And exhale real big. Perfect. Give me one more. Inhale. And exhale. Wonderful. I'm just going to go around the back here. Alright, once more. Go ahead and inhale. And exhale. Good. And one more. Inhale. And exhale. Perfect. Okay, and I'm just going to take your temperature real fast. So go ahead and open your mouth and just say, ah. I will be sticking this under your tongue and holding it there until it captures your internal temperature, okay? Alright, go ahead and open your mouth. Got it, okay. And you are just fine. I'll take a note of that. Perfect. Okay, so I am going to examine your eyes now. I'm going to take out my light again. And I do need you to go ahead and just look at my nose, okay? This light will be bright, but go ahead and just keep an eye on my nose, okay? Just checking the function of your pupils. Very good. Keep looking at my nose. Good. I'm gonna get quite close here. Okay. Okay. Very good. Now I'm just going to go ahead and cover one of your eyes and do the same thing. Very good. And the other side. Very good. Perfect. Okay. So now I'm just going to have you focus on these two fingers, okay? Focus on these two fingers and tell me how many fingers I'm holding in the background, okay? How many fingers do you see? And now? And now? And now? And now? Okay. Now go ahead and focus on these two fingers. Very good. And how many fingers am I holding in the background? Very good. Now, I just want you to remain focused on my fingers. I'm going to move them close to your face, and I just want you to tell me when it is that I touch your nose, okay? So, good. 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 And slower. Good. 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 Very good. Gotta bring the light back now. I just want you to track the light with your eyes only, okay? So please do not move your head around. Just keep it nice and still for me, okay? So just follow the light with your eyes, okay? And if it gets too bright, just look behind me for a little bit. Just follow that light. Very good. Yes, very good. Keep following the light. Don't let my finger distract you, just follow the light. Very good. Keep following that light. Mm-hmm. Very good. Perfect. Now, I am just going to measure the distance of your eyes using this little tool here. So go ahead and just again keep your head still and look forward for me, okay? Just going to measure. Perfect. I do need you to go ahead and just look at this chart for me. And just go ahead and look at that chart. Let me just grab my little pen here. And I just want you to answer a couple questions for me, okay? Can you tell me what number this is right here? Mm-hmm. Yes, okay. And what number is this right here? Mm-hmm. Very good. And can you tell me what these three are? What are these three little symbols? Mm-hmm. Very good, very good. Okay, now we'll get easy for a moment. What do these two say? Can you read them? Yes, very good. Okay, just checking. And can you tell me what way the little tines on this E are pointing? Up, down, left, or right? This one right here. Mm-hmm. And this one? Okay. And what about these? What do these say? Perfect. Thank you. Let me just write that down. Okay. And can you please tell me? Can you see and tell me what this color is? Mm-hmm. Okay. And what about this one? Can you tell me what that color is? Very good. And what about this one? Mm-hmm. And this one? Very good. And what about this one? Mm-hmm. All right. So, can you tell me, is this one darker than this one? Mm-hmm. Very good. And is this one darker than this one? Okay. All right. And last question. Which one did I ask you about first? Very good. Green. Okay. Again, I'll just take a quick note about that before we move on. Wonderful. So now I'm just going to touch your face a little bit and just make sure I did not miss anything here. Mm-hmm. Good. Nothing is uncomfortable for you. Good. Perfect. Perfect. Now we're going to test your memory just a little bit more to make sure that our cognitive functions are sharp and ready to go, okay? Perfect. So let me just grab my little tiny light if I can find it. Where'd you go? There you are. Okay. So I would just like for you to tell me how many times I blink this light, okay? How many times did I blink that light? Mm-hmm. All right, and one more time. Very good. Okay, and last time. How many times did I blink that light? Perfect. And can you tell me how many times I blinked the light the first time? Wonderful. Very, very good. So now we will talk about what you requested earlier. I know that you've been having a bit of pressure behind your eyes and your head has felt a little bit itchy. So let me start with your head and just take a quick look up here, okay? Just gonna okay, so you are just a little bit irritated right there at the base of your scalp. So I'm just going to take a little bit of a spray. This is just a spray that does soothe your skin. I will prescribe you a small dosage because it's just a little bit irritated, probably from maybe like too much scratching, or maybe you just got something a little irritated your head there. So maybe consider things that you've done or used that might be out of your regular practice, and maybe we can discuss that more in your next appointment. Okay, so I'm just gonna go ahead and take this, spray it, and just here. I'll just rub that around. Perfect. Alrighty, and then for your eyes, I would highly recommend ending screen time a little bit earlier if you can, because that does end up straining your eyes, especially if you're feeling that strain right before you go to bed. But I do also want to give you just a couple of eye drops to see if that does help you. So go ahead and just gonna take one and drop it into your eye here. So just keep looking up for me. Good, and right over here. This one. Perfect. Okay. So let me know, give me a couple blinks. Let me know if that makes them feel a little bit better. But I did want to let you know about some pressure points that you can hold. I believe this is an old Eastern medical practice of using pressure points on your orbital bones to help relieve the pressure from around your eyes, especially for like headaches as well. So I'm just going to press right here and hold for maybe a couple of seconds, and let me know if that helps release any sort of pressure or pain. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15. Right? It does release pressure. So I'm just gonna go ahead and write down those prescriptions for you. So I'll have just a couple of those. And I'll just give that to you. And lastly, I wanted to mention one last thing that would be very helpful for your eyes and the head stress as well. If you've ever used one of these, you can put them in the fridge or the freezer and they become very cool. It's just a cooling eye mask, but they work very well for headaches and pressure and redness and just, that uncomfortable feeling around your eyes. So I would highly recommend one of these if you don't have one already. They are not very expensive at all. So very lastly, I just want to do a quick follow-up exam for your eyes. Go ahead and just look up for me. Look up, look up, look up, look up. Very good. And look down, look down, look down, look down, look down. Okay, and look to your right, to your right. looking to your right. Good. And to your left. Very good. All right. So I'm just gonna go that in there. Thank you so much for taking a time out to come to the doctors and get a checkup. Everything is looking perfectly normal and fine, and your little head and eye stuff should be feeling better with the medications and the little tips that we've given you. So hopefully this was very helpful to you. I hope you feel relaxed and get to have a nice rest of your day or night. And yeah, feel free to come back and talk to the secretary on your way out to schedule a next appointment if you feel like you need one, okay? Perfect. All right. Bye. Thanks for stopping by.